Clinical examination of the central nervous system. General medical examination. Following the neurological examination, general physical examination of the patient, including blood pressure measurements and urine testing, are very essential. Certain aspects of the general examination are particularly relevant to the central nervous system and may give clues to the etiology of the neurological lesion. Skin lesions may indicate neurofibromatosis, stage Weber syndrome, or tuberous sclerosis, all of which has important neurological associations. So the contour of the skull may be a vital sign in a patient with Paget's disease, meningioma, or development anomaly in the region of foramen magnum, as in Arnold Chiari or Chiari malformation. So Arnold Chiari malformation. So the patient with signs suggestive of a spinal cord lesion may always have his vertebral column carefully examined for deformity or tenderness on percussion, and to look for any focal skeletal abnormality. When the patient is unable to raise the leg to 90 degrees above the couch, this may indicate nerve roots irritation in the lumbar spinal canal. And the patient with suspected meningitis or subarachnoid hemorrhage should be examined for neck stiffness on passive flexion. Auscultation of the skull or orbit may review a bruise denoting arteriovenous malformation, fistula or aneurysm of the carotid and subclavian arteries. In the patient with acute hemiplegia, possible etiological factors in the cardiovascular system must be identified, including hypertension, carotid bruits, and rhythm disturbances. Hypertension may result in cerebral hemorrhage, and the presence of carotid bruits may indicate stenosis or occlusion of the internal carotid artery. Rhythm disturbance, which leads to cerebral arterial thrombosis, may result in cerebral embolism, and a common cause of this is atrial fibrillation, especially when it is intermittent. So you must also examine all the peripheral pulses by both palpation and auscultation to detect any abnormality. So eye signs may denote thyroid disease associated with clinical features indicating thyrotoxicosis. So metabolic disorders may be the cause of epilepsy or abnormal involuntary movements, including tremor. For any patient with signs of raised intracranial pressure, such as headache, papilledema, and vomiting, must be examined for signs of a primary neoplasm, such as bronchus, breast, or kidney.